Okay, there we go. So yeah, we wanted to do a quick poll of our participants, our families, to see what stage of treatment your child might be in, how old your child is, just to kind of get us a sense of who's here and a little bit of a background for us.
So you'll get a screen that pops up. Just click on the one that refers to you.
So it looks like we've got a few different ages and maintenance and long-term follow-up. So that gives us a good idea of kind of the stage and stuff that your children are in. So that's awesome. Thank you so much for participating with that one.
So anxiety in response to medical procedures is really common among children, with rates as high as 50 to 60% of children experiencing significant anxiety in response to procedures. And research shows that there's a strong link between procedural anxiety and procedural pain, in that more anxiety will lead to higher pain, and higher pain will lead to more anxiety as well. So the strategies to manage both overlap quite a bit. So a lot of what we talk about today will work for both managing procedural anxiety and procedural pain. And high procedural anxiety has been shown to be associated with a number of different consequences, both during the procedure and after the procedure and longer term. So for example, during the procedure, higher procedural anxiety is associated with poorer cooperation, which can lead to longer completion time to complete the procedure, making it harder to complete the procedure. It's also associated with greater pain reports during procedures and can lead to an overall more negative medical experience. During the recovery time, it can lead to a longer recovery period and again, higher pain reports during the recovery period. And then even longer term, high procedural distress or anxiety can lead to fear of future procedures, higher procedural anxiety during future procedures, and general behavioral challenges. So for all of these reasons, it's really important that procedural anxiety and pain is well managed.
So we just wanted to kind of highlight how there's 12 procedures and tests listed here. And so for kids who are diagnosed with different forms of cancer, they will probably experience or undergo one or all of these. And potentially what happens is they'll potentially experience these in within the first couple of weeks of diagnosis, and then we'll continue to get these sort of procedures. So if you think about it, like our threshold for coping, even as adults, we might be able to cope with like a few of these things, but when you add all of these things together and multiple IV attempts and multiple blood pokes and things like that, your threshold for coping can definitely be lowered. And so we just kind of wanted to highlight that at the beginning stages can be really challenging for sure for families and kids especially.
Yeah, and so, I mean, I don't think I need to tell you guys this, but, you know, many children and families do report, you know, in research that procedures and procedural pain can be some of the hardest parts of having cancer, almost more than the illness itself. And so, you know, I hear that too in my clinical practice, that can be quite challenging, and that there can be a lot of memories of particularly stressful or distressing procedures that they've gone through. And so again, it's just to highlight that it really is important, because I also have a lot of kids and teens kind of telling me, you know, they remember all the great things that people did to make pokes less scary, or, you know, to make things go a little easier, or to help prepare them for things. So again, there's a lot that can be done, which is really nice. But again, it is one of those things that really sticks out in the minds of children and families. And so I would say too, you know, it's also important to think about the child's perspective. And so, you know, sometimes we as adults don't think that something is very scary, but it actually can be quite distressing for children. So here's an example from the hashtag Kids Cancer Pain campaign. And so it says, for Nathan, the 3 things that caused him the most anxiety were wearing a hospital gown, having the chest leads put on for the EKG during procedures, and having a gauze pad put under his Band-Aid. And so again, it's not always those things that we think as most anxiety provoking or distressing that cause distress, but it can also just be sort of the unknown or things that are uncomfortable. And so it's really important to think about each individual kid and help them with the things that are stressing them out. And so just for any of you who aren't aware of Kids Cancer, the hashtag Kids Cancer Pain social media campaign that was done for parents through the IWK and Sick Kids. Yeah, there's lots of great information on their website. There's lots of posts from healthcare professionals, from parents kind of sharing their experiences and that kind of thing with cancer pain. So we have kind of a final resource slide, and that link is on there. So we were just wondering, so we have a second poll here, what kinds of procedures your child has had and which ones they found most stressful or distressing. And that can be at present, that could be in the past. Okay, so let's look at a lot of these here: blood work, radiation, IVs, imaging, surgery, and G-tube. Yeah, LPs. And then in terms of which ones were most distressing, we're seeing blood work. Everyone found that distressing. IVs again, surgery, port accesses, so NG tubes, LPs. So yeah, a lot of those that involve sharp things. Okay. Thank you for sharing that. Hopefully everyone can just sort of see the results here. Yeah, and again, I think that's pretty common. I think I'm sure, Kim, you hear that as well, but certainly I do, in terms of just those ones involving pokes being a little bit more stressful.
Absolutely.
Okay. Thank you all for sharing that with us again, to give us some insight into what your kids find stressful.
Well, now the good news. We've talked a lot about how challenging it can be, but the good news is most procedural pain can be mitigated or at least reduced using inexpensive pharmacological, so like topical anesthetics, psychological and physical techniques such as comfort positioning and things like that. And so we're going to go into everything, all of those things today. So stay tuned.
The other thing we just wanted to make you guys aware of was the Commitment to Comfort initiative at the Children's Hospital. And so really this initiative is a site-wide quality improvement initiative developed to promote comfort by helping to lessen pain and distress. And so that the initiative really works to educate family and staff about different comfort and pain management strategies that are available to them. It sort of started in the emergency department and then moved out to the rest of the hospital from there. And so as part of that, you know, myself and Melissa will actually be doing a presentation for nursing orientation. So all the new nurses that come in, they get a little presentation on managing pain and procedural distress. And it was both from sort of a psychosocial perspective and also the pharmacological perspective. You know, we've done presentations for lab techs at the hospital, and also I think about 400 in the community from other blood labs. It's moved out to other sites throughout Alberta, and recently actually we've had other hospitals within Canada looking for some of our materials and some of that information. And so it's a really wonderful initiative. And again, I think it's just really important to know that this is more and more being seen as a really important strategic priority. And so as you're learning things to help your child through procedural pain and anxiety, just know that on the professional side, they're receiving that training as well. And also that if you're asking or advocating for your child in terms of some of these measures, I think too that people are very much more willing to hear it, just since, you know, in the last few years, as this has become more and more part of the culture at ACH.
Yeah, so we are going to break it down for strategies before the procedure, during the procedure, and after the procedure. And what we wanted to highlight too is that a lot of these strategies you definitely might have heard, but what we know from and you guys know, is that each kid is so unique and so different. And so just because you've tried maybe one or two of these strategies, maybe what I found in my work is a lot of trial and error. It's a lot of kind of tweaking small little things in terms of strategies to see what might work best kind of for your child. And we know too that kind of using some of these strategies together can be more impactful than trying to use one or two of the strategies kind of in isolation. But when we can kind of use them all together, that's often when we find a little bit more success in helping to reduce that distress in procedures. So we're going to start before the procedure. So before the procedure, it's really important for preparation and to make a plan. So in terms of preparation, kids need to know kind of what to expect. So if you're not sure what to tell them maybe about an upcoming test or procedure, what can be really helpful is to tell them what they might see, what they might hear, what they might feel, what they might smell, what they might taste. Give them a sense of some of the senses that they're going to experience. The Simply Saying app is a really good prep app that you can download. It gives you kind of some words to use for different tests and procedures like that, and just gives you some ways to say it in kind of a really nice and developmentally appropriate way for your child. And then behavioral rehearsal. It's really important. So once you kind of talk to them about what they might experience, sort of practice some strategies ahead of time. And so when you practice these strategies in kind of a calm environment, such as your home, and really practicing and having them feel these strategies in their body, like deep breathing and what it feels like to hold their body still. It's much easier to integrate these strategies when you're calm and relaxed versus trying to integrate them in the moment. It can be really, really tricky to implement them in the moment. So we do that as child life specialists through medical play. We teach different things as well. I've had a lot of people ask me when to share information. That's a big one. And so for each kid, it's so different, but some kids, they need a lot of time. They need a lot of time to process the information. They need a lot of time to think about it, ask questions. Whereas other kids, if you told them too soon, they would ruminate, and that distress or anxiety might get bigger and bigger. So really knowing kind of how your child best receives information can be really important to when to share the information with your child. I wanted to share an example. When I was working with a child in the hospital, I knew that he was going to have an IV start the following day. And he hated IVs so much, and he was really scared, and they were really distressing for him. And so because I had worked with him for a really, really long time, I decided to tell him the day before. Everyone was like, don't tell him, it's too soon, but I knew for him, he needed some time with it. So I told him the day before, and he got really mad, and he shouted, and he kicked, And he, for about 45 minutes, he was really upset. And, you know, I could see some people saying, I told you so. But after that 45 minutes, and I just let him feel those feelings. And after that 45 minutes of being pretty upset, he started asking me questions about the next day, and he was able to calm himself. And once he started asking questions, I knew that he would be able to work through some of those strategies and things. So, and it actually went really, really well. And so once you've kind of talked about and prepared your child, what can be really helpful is making a coping plan. So the Alberta Children's Hospital has these comfort care plans, which we actually have access to. So if you'd like a copy of them, you can, or you can make your own. And what this does, it gives your child a sense of control and the ability to kind of have a say in what's happening to his or her body, right? So giving real choices that are available. So, you know, do you want to look? Do you not want to look? Do you want to have this distraction or this distraction? And really involving them in the plan can be really powerful for kids. So topical anesthetics. So the Alberta Children's Hospital, in the outpatient clinic, I've been told they often use Ametop. So to be honest, in my experience, I found a lot of success with this. But what I have done for kids, I've actually had them test it out ahead of time. So to really integrate that it works, that it can help. So again, when you're calm and in a safe kind of calm place, test it out, because there's no harm in putting a little bit somewhere and testing out one area of your skin and saying, what do you feel there? And then testing out the area where you had the numbing agent, and just ask your child what they feel. And this can really help them trust the process and trust that it can help to make it feel a little bit better. I mean, some kids tell me it feels like pressure. But I know too, because I've actually used it myself, that it's actually can be quite effective when used in conjunction with these other strategies that we're talking about. Some kids find the tegaderms, so the sticky that you can see there, to be most distressing to take that off. So things like saran wrap and the press and seal, the Glad press and seal, can really mitigate that one kind of stressful element. So ask us after too if you have questions about that.
Yeah, I would also just add too that that's something I hear a lot about, the stickiness. And so there are actually different bandages as well that they can use in the day room if you're going to clinic or anything like that. So you can ask them. I think it depends on how long they're going to be accessed for, but if it's just a brief access, I think they can use less sticky dressings than if they're going to be accessed for several days. And so that's another thing you can talk to your nurse about, usually before they access your child.
Right, so now we're going to talk a bit about language around pain. So as these pictures on the screen suggest, children can be very literal. So for this reason, the language that we use to explain procedures and pain are really important. So when talking to your child about upcoming procedures, it's important to choose developmentally and age-appropriate words to describe the procedure and what they can expect. And also use words that are familiar to your child. So if your child prefers to say poke instead of needle, then make sure that you're using words kind of consistent with their preference and ways to describe different parts of the procedure. It's also important to be aware of your nonverbal body language when describing procedures. So if you're preparing your child for an upcoming procedure and you're cringing the whole time that you're explaining it, your child will pick up on that, and it can lead to higher anxiety as well during the procedure. And lastly, it's really important to be honest to your child about upcoming procedures and what they can expect. We really don't want to build distrust around procedures or going to the hospital. So here are some examples of some commonly used terms, and then some more child-friendly terms that can be used instead to reduce anxiety. So I won't go through them all in detail, but I'll just go through some of them. So instead of saying don't move during a procedure, you can try saying it's important to try and keep your body still. Instead of saying be brave or don't cry, you can instead say sometimes kids need to cry and that's okay. And that really normalizes and validates the feelings that your child's having during that procedure. And when children ask if it's going to hurt, which is a common question, it's really important not to lie and say that it won't hurt. But instead you could say that some kids say that it's a weird or uncomfortable feeling, but that it can feel different to everyone. And maybe after the procedure, you can let me know how it felt for you. It can be really helpful to practice some of these more child-friendly terms and practice ways that you want to describe procedures to your child, because a lot of times it doesn't come naturally to use that type of language. So it can be helpful to practice that and really plan how you want to describe the procedure to your child. It's also important to be careful around language used to describe nurses and staff. So a lot of families will have favorite nurses or favorite staff members when they go to the hospital, but it's just careful to not kind of like say, here comes your favorite nurse or the nice nurse, because we don't want to imply that other nurses and staff members aren't nice and stuff like that. So just being careful around how you describe other people as well.
And the last point is just sort of preparing yourself. So, we've kind of gotten to the point, you've got a really good plan, your child has given lots of good information, you've really thought about the language that you're going to use with your child. And then when it comes time for the procedure, it's really important to know that children really pick up on parental anxiety and parental feelings. And so this is across different medical settings, this is across different medical procedures, this has been shown again and again in the research. And so it's really important that you check in with yourself around your level of stress, around your level of anxiety. And, even if you are a bundle of nerves or really stressed out inside, if you can even fake being calm, that is better than not. But yeah, if you can get actually calm by using your own coping strategies, whether that's taking a deep breath, whether that's talking to a friend or your partner, another parent, about kind of your feelings about what's going to happen, just acting calm will help to keep your child calm. And so again, things to be aware of too, using a normal speaking voice. So even if you're using wonderful language like, oh, aren't you really, you're set for your poke, yeah, we're all set, we're good. That's clearly not going to make anyone feel calm. So just trying to be aware the pacing of your language, the expression on your face, like Melissa was saying for the other stuff as well. And then also just being prepared to coach your child on using their coping strategies. And so, the nurse's job is really to help find their button or whatever it is for their port access. The child's job is to stay still and do whatever distraction that you had planned. And your job as a parent is to coach them and to stay calm. And so really even outlining those jobs explicitly can sometimes be helpful, but, just keeping in mind that, you don't have to know everything that's going on or be in charge of everything. Just really that's your primary is to just stay calm and help your child through and use those strategies they know how to use just to keep themselves calm. Okay, so now we have got some audience participation time. And so we're going to run through a couple scenarios and just get your thoughts on what you could maybe do based on what we've been talking about. And you don't have to be a parent in order to answer. You could be another individual who's been sitting through our talk today, so please feel free. So the first example is your child has blood work scheduled for tomorrow. What could be done in preparation? And again, we don't need this big, broad coping plan. It could be sort of just little tips and tricks that we've maybe mentioned. You just type those in the chat box. Okay, we've got an answer here. Oh, favorite stuffy. Love it, excellent. Kind of a comfort animal. got talk to her about it, maybe practice on her favorite doll. Perfect. Yes, so some of that procedural preparation, you know, letting her know in advance, which is great. Not sort of surprising or lying, as we were talking about. Oh, okay, your kid likes to know exactly when you're going to leave and see the Emla cream out on the counter. Perfect. So some of those, so those pharmacological strategies too, the numbing cream. So that's perfect. All right, maybe we'll move on to the next one now. The next example is, you know, when we were talking about language, we were sort of being careful around the language we're using. So instead of saying, don't worry, the shot won't hurt at all, what other kinds of things could we use? What kind of language? How can we change this to explain it in a more helpful way? Yeah, we're gonna get our poke, perfect. And she wanted to even enhance that a little. We're gonna get our poke, and you know we're gonna use the freezing cream that I know helps you every time you've gone before. And then you know we're gonna go get whatever prize, so McDonald's, or then we're gonna go get an ice cream, or you know something like that. Or to plug Child Life, you know, we're gonna get our poke, and Child Life is gonna be there, and you're gonna get to see them, and they're gonna help you. And when we're done, again, then yeah, we're gonna go get McDonald's. Okay, perfect. Thank you all. So moving on then, we've kind of gone through the before.
Okay, so now we're going to go through some things that parents can do during procedures to help reduce anxiety and pain. So there's been a lot of research done showing us that parent behaviors during procedures are strongly related to child anxiety during the procedure as well. So this slide lists a number of unhelpful behaviors that are often used and provides some ideas for more helpful behaviors that could be used instead. First, I just want to highlight that many or all of the unhelpful behaviors are well-intentioned, and all parents and all staff will engage in these behaviors at times. It happens, and permanent damage is not going to be done by doing any of these unhelpful behaviors, but it is just really good to know that there are helpful behaviors that can be done instead in place of the unhelpful behaviors. So the first unhelpful behavior that we have here is apologizing. And the reason that this is unhelpful is because we most often apologize when we do something wrong. So by apologizing during a procedure, we're implying that something bad is going to happen. So it can really just set children up to feel anxious during the procedure. The next one is reassurance. And this can suggest fear in the parent or the staff member and can really direct the child's attention to their own anxiety and their own pain during the procedure. Criticism can be really subtle. So even saying things like, your brother was so brave when he did it, or be a big girl during the procedure can increase anxiety and kind of suggest to the child that they're not doing as well as they should be during the procedure. And then the last one is setting up negative expectations. So by saying things like, this is going to be hard or scary, but it'll be over soon. If we're saying those things kind of before the child's even showing any anxious behaviors, it can really focus their attention on that this is going to be hard and scary and increase anxiety during the procedure. So while all of these are well-intentioned, the behaviors should be avoided because they're really directing the child's attention to their anxiety and pain. So in place of those behaviors, some more helpful behaviors that can be done are really focusing on promoting coping during procedures. So providing praise to your child, encouraging them and coaching them through their coping behaviors, and minimizing their attention to the procedure or pain by kind of reminding them to use their distraction strategies and other strategies that you've planned beforehand. So if your child is really upset during the procedure, instead of saying, this is really hard, you could instead try to distract them towards something else during the procedure to kind of help take their mind off of the anxiety and pain that they're feeling. It's also good to offer choices when appropriate and making sure that these are choices that where the child actually does have a choice. So instead of saying, let me know when you're ready, you can instead ask the child which arm they want their poke in. So that really gives children a sense of control over the situation and can help to reduce anxiety. And then the last one is medical reinterpretation. So that's kind of reframing the medical equipment or procedures in a less threatening way. So instead of saying tourniquet, you could call it Mr. Stretchy, or instead of saying like you're going to have your MRI, you could describe it as like the spaceship procedure or something like that.
So we wanted to bring up comfort positions as well, which I imagine a lot of you are very familiar with different comfort positions. But the reasoning behind them is to minimize the impact of being vulnerable by laying down. We know that the laying down position can be one of the most vulnerable positions for kids, for teens, even for adults. So the idea behind these comfort positions is that kids can still get their tests and procedures done in a safe but also supportive way. So oftentimes we think of comfort positions for little ones, which can be great. But as you see here in this picture, there's also kind of a side-by-side sitting comfort position with a teenager. And I worked with a lot of teenagers who actually that's a really supportive way for them to get an IV or a blood like a blood poke or even an access. So I wanted to actually really quickly introduce you to Larry. I'm just gonna check my screen, make sure you can see. You can't see him. So this is Larry, okay? So we basically just wanted to give you kind of the difference. So something like this, like a back to chest comfort position might be really beneficial for a port access, for an IV start where you can kind of hug your child for blood work. And this is really helpful too if your child likes to see what's happening or likes to watch, or if you wanted to attend the distraction this way, that's really beneficial. But something that might be really good for immunizations would be maybe something like this, especially if your child does not want to look. So this can be really beneficial for a child who just does not want to look, or who, when they do look, it causes them more distress. And again, each child is so different in terms of what works for them. And so I've had kids who cannot look, and I've had kids who've looked like this, and they just needed to see it that closely. So just really finding that the right position for your child can be really beneficial as well. And so we'll say bye to Larry.
Thank you, Larry.
So distraction, I'm sure we've all used distraction in one way or another. But what I wanted to highlight here is just the difference between active and passive distraction. So again, kind of figuring out what might be right for your child. Some kids that I've worked with, really something like a video is perfect for them. What I've experienced though in my work is that sometimes when kids are really familiar with the test and procedure and say they find it really distressing, just having something passive like a video is not quite enough. Sometimes they tell me that they need something else to kind of really occupy their mind, because our brain is really powerful, and it actually can tell us, it kind of filters the pain perception. So if we can really positively distract our brain, it can actually help with the actual feeling of pain. So I wanted to give an example. I had a teenager who, she tried everything. We worked through a lot of trial and error. She initially tried watching a video, and it just wasn't enough, because she did find IV starts quite distressing. And then finally, after a little bit of trial and error, we actually utilized her mom telling stories where she was present. So she actually could close her eyes, she didn't have to watch, and she could recall that memory. And for her, that was a really positive kind of active distraction, to be able to kind of distract her mind from what was happening. So to decide on the distraction technique ahead of time. And again, this comes back to making a plan. So seeing, letting your child pick what might work. And then coaching your child through the distraction during the procedure is really beneficial too. So changing their attention back to the distraction item can be really beneficial. We wanted to just pull out a few really good strategies for different ages. For toddlers, a lot of the times what I'd like to do is kind of show them a toy and see if they really liked it. And if they did, if it was really engaging, I would then make sure I kept that toy for right when we were going to do the procedure, and say right before an IV start or an access or something, I would kind of pull out that really novel toy again, right at the kind of the right time. So that can be really beneficial. School age, I used a lot of the iPad and tablet, and I would play a lot of games. So I actually found that there's a Jenga game on the iPad that's incredible, because you just need one hand and you really got to pay attention. It's like real life Jenga, but you really got to pay attention. And again, for adolescents, I used a lot of non-procedural talk. I used a lot of stories, visualizations, and memories. Can be really, really beneficial.
Yeah, and Kim, just to add to your comment on the games on the tablet, I've heard from lots of parents that Child Life at ACH has some of the best games on their iPad, ones that their kids haven't seen. And so a lot of the times they'll kind of save those games, even though of course they could download it themselves. They don't download it onto their iPad, and they kind of save it for when they're at the hospital, so that they're extra engrossed and extra engaged, because it's something that they don't really get at home. So when you said that, that just kind of reminded me. I've heard that a few times. Nope. Okay.
Oh, sorry. We just wanted to highlight a video to kind of show you two different scenarios, and then we can kind of chat about them after.
Yeah, come see me. She's like, no, no, Daddy. Come here. Do this quick. I know. We're gonna do this quick, 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 honey. Oh, you can just stand up right where you're at. Hey, catch the bubble. Oh, don't worry, don't worry. I can do it. I always did it the first time. Don't worry. Oh, catch the bubble. Catch those bubbles.
Where is Daddy? Oh, he'll be back soon. Daddy will be back soon. He will. Oh, I'm so sorry.
All right. Doing the washing, you're getting ready. Okay, now what's the important thing to remember? Get your hand out here and keep it away from the IV. She'll let you know. 1, 2, 3. She'll count for you, okay? Oh, squeeze the ball. Okay, now Christian, take a deep breath and blow it out for me. Good job. Another one. In. Blow it out. Good job. The needle's coming out, but we still have to hold still, okay? Just gonna try the drink. You doing okay? Okay, deep breath. Good job. You're doing such a great job holding still. Should we do the iPad now that takes over while she's doing the rest of her work? She's gonna tape it up for you? Yeah. What do you want to do on here, buddy? I can't remember what game it is. I know you like to do the there's like the spider. Where's the spider? Can you find it for me? I don't know which one you're talking. The ants?
So the one voice technique is basically an acronym to set up the environment, to create a more calm environment for kids when they're having tests and procedures done. And essentially it means exactly what it says, and having one kind of main voice coaching that child or talking to that child through it. And then that could be you as a parent, it can be one designated person, it can be kind of anyone, but just not having every single person trying to do it at once. And again, all those things that we mentioned with apologizing and telling them that it would be okay and all of that. So and then the positioning as well. So it's basically like how to create this kind of whole different environment for children. And show of hands, has anyone experienced the first scenario? Has anyone experienced the second scenario? Show of hands. Okay. It happens for sure.
Okay, so even after the procedure, there are some things that parents can do to kind of ensure that anxiety might be a bit lower next time. So there's a lot of research out there too that shows us that children's memories of stressful and painful medical procedures can influence their anxiety and pain during future procedures. So specifically, children who experience higher anxiety and pain often develop more negative and negatively exaggerated and less accurate memories about the procedure. And then these memories can lead to higher anxiety next time. So the good news is that children's memories of procedures can be changed through memory reframing. So to do this, after the procedure, just talk to your child about what went well, the success that they had, what strategies they used that were really helpful. And it can be good to try to get this information from the child. So have them kind of like reflect on the pieces that went really well, what strategies they found to be really helpful during that procedure, and just kind of focus on that rather than the things that maybe didn't go so well. And then also, after doing that with your child and kind of reframing the memory to kind of form this better memory of the event, it's then important that when you're debriefing with maybe the parent that wasn't there or grandparents or somebody else about how the procedure went, just be mindful that your child might overhear you. So if you're saying like it was a total disaster, couldn't have been any worse, just be careful that your child isn't overhearing that information, because then all of the work that you just did with reframing the memory will be gone, and that will stick with them, and anxiety can be higher next time.
All right, and then the last thing we thought we would talk to you a little bit about is troubleshooting. And so, you know, sometimes you do everything right. You make a beautiful, wonderful coping plan. You know, during you're calm, you have all these distractions ready to go. You've got the numbing cream on, and still your child has a little bit of a meltdown when they get to the clinic. And again, that happens to everyone sometimes. And so we thought we would talk a little bit about why that might be the case. So to understand why you might have this really wonderful plan, but things might still not go your way, you really have to understand a bit about the brain and anxiety and trauma responses. And so some of you might already be familiar with the example of flipping your lid from Dan Siegel. So I'll just kind of go through that very quickly here. So this is my hand here is sort of my spinal cord. Then we've got the brain stem, and then in here we've kind of got the limbic system, sort of that old brain that's sort of there from in all mammals. And so here you've got your big emotions like anger and fear, anxiety and sadness. You've kind of got you know, that fight, flight, freeze response. And again, you know, if you think about startling a cat or something like that, and it kind of like goes like this and the hair stands up, you know, that is a really good example of that fight, flight, freeze response in action. And so we as humans also have this cortex that kind of goes over, and specifically if this is sort of the front of my brain here, we've got the prefrontal cortex, and that allows you to be calm, to think rationally, to have mental flexibility, to plan and organize things. This is kind of what, you know, also allows you to, you know, manage your emotions, to think, oh, well, I'm feeling kind of stressed. I should probably take some deep breaths, or maybe use some of those calm down strategies, like, you know, a coping thought, like, oh, I've done this before and I can do it again. And so, you know, when a child has had a really negative experience before, like medical trauma, they are going to be much more likely to flip their lid. And when that happens, that whole ability, their ability to regulate their emotions, their ability to sort of calm down and use those strategies in the moment is just gone. And you've just got that fight, flight, freeze response. And so that can look like kicking and screaming and crying for that fight response. The flight response is trying to get away. So maybe that's literally trying to run away. Sometimes it's more of that stalling or, you know, delaying, negotiating, whatever it is, because they're trying to avoid it. Sometimes it's freezing. And so you're asking questions and they just aren't saying anything or aren't responding to you. And so again, those are all sort of that fight, flight, freeze response in action. And so again, you can have a really great plan, but sometimes your kid is just, you know, too stressed out and they flip their lid. And it's just important to know that that's kind of not, you know, them on purpose, not paying attention to your plan or not listening, but it's just one of those things where their lid is flipped and they're just having a really hard time regulating their emotions. And so hands up if anyone has child has ever flipped their lid, either in the context of a medical procedure or in the context, even just, you know, in the grocery store when they don't get a toy that they want or treat that they want. Seeing some hands up, some nodding, some smiling. Okay, perfect. And then, I mean, we as adults, right? If we've also flipped our lids a lot of the times when our child flips their lid. And so again, it's a normal reaction, but you know when you can't be rational anymore. And so again, it's kind of a matter of recognizing that and managing that. And so some of the strategies you can use as a parent is kind of staying calm yourself. I know I said that earlier, but again, co-regulating. If you're regulated, you're using your breathing to calm yourself down. You can kind of co-regulate with your child, help them to use some of those strategies. Reconnecting. So maybe that's physical, through physical touch, like cuddles and hugs. Maybe that's verbally through things like, you know, reassurances that you're not mad, that you're still proud of them, that you still love them. That kind of name it to tame it. So sometimes it's just kind of pointing out what the emotion is. Like, I see you're scared right now, or I see you're mad, or, you know, I see what's going on for you and you're just having a hard time. And just letting them know that you're there for them and you're going to help them, you know, feel that emotion and then also kind of get over that emotion. So maybe it's helping them to calm down through deep breathing. I've got some great, you know, developmentally appropriate ways to teach deep breathing. If you don't have some in your pocket already, we can talk about that during question period. You know, maybe it's just, you know, hugging a stuffy, whatever it is that you find helps to calm your child down. And then, you know, once they're a little bit calmer, that's kind of when you can start to go back to that plan. The lid is back on. You can use those plans, those strategies, those breathing strategies, or not breathing, but you can use those sort of more cognitive strategies because their lid is back on. But when the lid is off, a lot of that reasoning and talking about the plan you had is not going to work. Another common mistake is kind of trying to reason with them when their lid is off. So sort of saying, well, we know we need this medicine. We've talked about it before. If you don't get this medicine, this, that, or the other thing could happen to your body. Like, they know that on some level, but in the moment when that anxiety takes over, when that kind of, you know, underneath brain takes over, they're really not going to respond to logic. And so that's not really the time to kind of go through that reasoning. The appealing to the lid when the lid is off. And then the other thing to really be careful of is not allowing complete avoidance. And so again, like I was saying, it's important to kind of pay attention to the emotion to help them to calm down, but we also need to move forward and keep going. So once, you know, we feel like they're calm enough, then we're going to keep going, because we don't want them to learn that, you know, having a meltdown or flipping their lid leads to not having to do the procedure, because that actually will lead to more of that anxiety and that more of that behavioral response in the future. And so, you know, when we're seeing that kind of challenging behavior, you know, like I think Melissa said earlier, around choices. So you can tell them politely instead of asking. So you can, you know, instead of sort of saying to them, you know, are you ready for your poke? The answer is probably going to be no, and you're going to go ahead anyway. And that is not a nice way to respect your child's autonomy. And so it's better to do is sort of say, okay, well, it's time for your poke now. You know, do you want to sit on my lap? Do you want to sit on the chair? Which stuffy do you want? Which game do you want? And so again, just telling instead of asking if it's not actually a choice. Noticing and praising behaviors you want to see. So that really shines a spotlight on that behavior. So, wow, amazing, good job. You took your shirt off all by yourself and got up on the bed to get ready to have your button done. You know, stuck your chest out for the nurse. Oh my goodness, good job. Again, kids love being praised by their parents. So, you know, being able to do that, you'll minimize more of that naughty behavior where it's kind of a joke and they're sort of pulling their shirt down like this to get the nurse to take some time and, you know, play a game of let's find your button. And then ignoring, delaying, and negotiation. So again, that does come out of having a flipped lid, just being really worried. And so they just, you know, start to negotiate. Oh, maybe give me 5 more minutes. I want to do some breathing. I want to do this. I want to do that. Or delaying. And so, you know, or give me a bigger toy. So just kind of gently ignoring that, redirecting to, okay, you're coaching what you're supposed to be doing instead. So all of those are helpful kind of, again, when you're seeing that the lid might start to be flipping, or when you're seeing some of those challenging behaviors that come from that fight, flight, freeze response. The final thing I just wanted to touch on was kind of, you know, advocating for your child. And so again, you can make a really, really wonderful plan ahead of time with your child life specialist, with your psychologist, with your child. And then in the moment, the healthcare team might not know what that is. And so you're the one who's been with your child from the beginning of their cancer journey. And so, you being able to share with them, what some of their past experiences have been, what some of their unique experiences or unique needs are, what works well in the past, what kinds of things set them off. And so, I'm just thinking of a child that I worked with, on the unit, and where he really, really, really hated dressing changes. Sometimes they would take up to 4 hours to get done. And so he would engage in all those delay tactics and negotiation and that kind of thing and say, I'm not ready, come back in 20 minutes. And so we made a plan, him and me and his mom, around, the nurse was going to come in, she was going to respect him if he needed a break, and he could say stop, and then she would give him about 10 to 15 seconds, and then she was going to keep going. So he had some control. And so, I kind of let mom and him kind of just finalize, fine tune that plan. I let the nurse know to talk to mom ahead of time outside the room, and then mom updated the nurse on exactly what she wanted the plan to look like, kind of gave that extra parental permission. Like, he might be saying, I'm not quite ready at 15 seconds, but it's okay to keep going if he seems calm enough. And then they kind of proceeded. And afterwards, the mom was just like, wow, that was the fastest, that was the best kind of dressing change I've ever seen. It wasn't Disney movie perfect. There were still a few tears. There was some attempts at delaying, but also, it got done very quickly, and he felt very confident and very proud of himself afterwards. And I think that was a really nice experience. So it's a great example of how mom could be there and just sort of help the nurse to understand her kid, and then be there to coach him in the moment, and then use that positive reframing after. So so I think, again, you know your child best, and it's great if you can convey that to the healthcare team. I know it's tricky sometimes, and if you need any help with that, certainly Child Life and psychology are always happy to step in as well if you need some help. And then I want to throw it over to Kim. I think she had another really good example.
Yeah, so we just wanted to provide a few more examples in terms of like advocating and different scenarios that might happen. When I was at the Stollery, a lot of times what would happen is a child would be scheduled for blood work first thing in the morning. And what would often happen is the night nurses would be transitioning out, and then the day nurses would be transitioning in. And in that shuffle, oftentimes was when the lab would come. And so oftentimes that meant, there wasn't necessarily a nurse present to help, say stop the lab and say, oh, wait, oh, can you wait? We haven't got numbing cream on, or sometimes too, when you're startled and you're not necessarily expecting it, it's hard to convey, okay, no, this is our plan. But what I would do sometimes, and what I encourage parents to do, if it's possible, in a scenario like that, to say, if it's not urgent, can you come back? My child does better with numbing cream and with a little bit more kind of that preparation. Can you go see one other kid? And in that time, my child will have been able to get some numbing cream on, and we can have a little chat, and then we should be good to go. So I think knowing that sometimes that's an option, and just asking. I mean, sometimes it's not, and sometimes it's urgent, or sometimes it's not, that you don't have that option. But there's always an opportunity to ask and advocate that way.
Yeah, and I've found at the hospital that, the nurses and the doctors are very good about telling people when it's not possible, when it is really urgent. But, a lot of the times there is a little bit of wiggle room, whether it's, 30 minutes to get the EMLA working or whatever it is. So I think, yeah, like Kim is saying, you can always ask.
Yeah, and so we wanted to highlight too, just some of the programs that are available to you all. So I'm the Child Life Coordinator at Kids Cancer Care. So I actually do a Child Life at Home program. So if you do have a child who's having an upcoming test or procedure and you wanted a little bit of guidance or support, I can actually do one-to-one sessions. So kind of in the home, at our Child Life office, over Zoom. We've got to get creative these days. So that is an option available to you. As well, Dr. Melanie Kuo is available by referral. even for outpatients. So you just need to talk to your physician or primary nurse for a referral to Dr. Melanie Koo at the hospital. There's also child life specialists available at the hospital. So even say if you're going for an outpatient test or procedure that wasn't necessarily involved with the oncology clinic, you could ask your doctor or primary nurse for a referral to the outpatient child life, and then they can follow up with you. And then there's always child life specialists on inpatient units, and you just have to ask your nurse to call them.
And I would say specific to the oncology day room, you know, a lot of you have probably met Cindy and Shannon already, but sometimes, you know, if they haven't been paged and you'd like them there, you can ask your bedside nurse for that day. And sometimes what I've noticed too, you know, Cindy and Shannon will be very involved in the beginning with helping children get used to having their port accessed and that sort of thing. But if you notice your child, for whatever reason, maybe they had a bad poke, or you know, maybe they're getting a little bit older and they're not as comfortable as they used to be with pokes. You know, if you weren't using them for a while and you'd like to have them come back again, you can certainly ask your nurse to page them back. And you know, again, you know your child the best. And so if you're seeing that there's a little bit of a difference compared to how they used to cope, absolutely feel free to ask to have child life come again if they've stopped coming as frequently because your child was doing really well.
All right, so we've talked about a lot of different things today, so I just want to summarize some of the take-home points. So before the procedure, it's just important to make a plan with your child, have that plan ready to go once you get there for the procedure. During the procedure, again, just we've said this a lot, but important to try to stay calm yourself and manage your own anxiety. Your child will feed off of that and feel less anxious as well. And then after the procedure, it's just important to focus on what went well, talk to your child about that, try to kind of elicit from them what they found went really well, what was helpful for them, and reframe those memories if necessary. And again, just remember that you are your child's best advocate. You know your child's best and what's going to be the most helpful for them.
All right, so I think Nikki's been monitoring the chat, and so if there are any questions that have come up, maybe you can let us know now, or if anyone wants to just unmute themselves and ask a question. We don't have a huge group, so we're not going to have a bunch of people talking at once.
We don't have any questions in the chat box. And feel free to, you know that you could email us to let us know if you have any questions, Kim or myself. I can forward them to Melanie or Melissa. Did you want me to do a poll to see what strategies our group will leave with?
Sure, absolutely.
So the poll just appeared on your screen. So click as many strategies that hopefully you'll leave with. Good, so I'll just end that and share. So definitely the plan sticks out there, and topical anesthetic. I like the distractions, knowing the child life has some different games than your own kid's iPad, that might be beneficial. So that is great. So if there's any questions, sorry, probably families typically have access to such info at ACH when their child begins treatment. Yeah, so I believe at the Children's Hospital, and maybe Melanie, you can correct this, families do receive a binder, and there might be some tips and tricks in there from Child Life or psychologists Is that true?
Yeah, and then there's also, they have those comfort care plans that I think we had several slides back there. We do have paper copies of those, so often parents will get that as well. So one's a little info guide for parents and has a lot of the same information as part of the commitment to comfort. And then, yes, I think they do also get some of this advice, but you know, I think also just sort of living it for the first time, you know, with child life present on the first few like port accesses, I think a lot of the times that's quite helpful and they can model some of that behavior. Yeah, I mean, great question. I think I would love for everyone to come see psychology if they could. But we are referral only, unfortunately. And so it's usually from a psychology perspective, it's just if someone's identified as either wanting psychology or having a few struggles where, you know, child life is, you know, tried quite hard and still they're having some issues, then often they'll come to psychology for
That's
sort of that more personalized one-on-one coaching.
I also just wanted to add, I'm actually here for KAM support group, which is a mother support group. And we post everything in files on we've got a private Facebook page that's for moms only. Doesn't matter where they are in their treatment. Thank you, Nikki. And we post files, we post information. We have our own locker with supplies. We have a bunch of different ways of support, but anything like this would go straight onto our Facebook page and help the parents. So we try to get the parents in as soon as they're diagnosed. Of course, we miss some, but we work with KCC and we kind of overlap each other and make sure that we try to get everybody with the big net. And yes, that's what the A stands for, but I can't say that out loud.
Yeah, I know I've talked to lots of moms that really find that group to be just so wonderful to have that peer support. So yeah, I think and it's great that you're sharing all of those resources too.
And pre-COVID, we were trying to get it to expand a little bit in Edmonton and stuff. So Robin, we'll touch base a bit more about that. But it is a great support group. So thank you for starting and leading that with Inga. Okay,
Robin,
Melanie, go ahead.
I was going to see if there was any questions that you see come up often, Robin, in terms of specific to procedures or issues that you see a lot of.
Let us know.
Can you guys hear her?
No, I'm just chatting.
Oh, I was just gonna say, Kellen has a distraction that's kind of a little bit different than everybody else's, but he actually has a stopwatch in his hand and he challenges the technicians to beat the technician before getting the blood out.
I love that idea.
He holds it. He's like, just to let you know, the last lady got it out in 17.5 seconds. And so they're like, what? We're on a clock? And he's like, gotta beat her. And then they're like, okay. And then if they don't, he's like, sorry. Yeah. And so, but he keeps it logged. So the next time he comes in, he says, oh, she did it in 14.2 seconds. See, that's what you're gonna have to be this time. So he makes them work for his distraction, I guess. So it works for him.
Awesome.
That is a great idea.
Yeah, it's honestly so personalized. Like each kid is so different. Like I had one girl who she was very specific. She like needed certain positioning. She needed to close her eyes at a certain time. She needed kind of to know when everything had left the room, and like each kid is so different. Each kid and teen is so different. So it's really cool to come up with like those unique things. I would do that sometimes, which is, I don't know if I should have, but I would bet kids they couldn't count to 10 before they had the sleeping medicine, before they fell asleep. And then they would wake up and they'd be like, I got to 11. And that would be like the first thing that popped into their heads when they like I had one girl and I was actually there in the recovery room and she was like, I got to 12.
Yeah, I think being playful.
Yeah. And then, you know, the anesthetists were involved too. So they were like, okay, well, I'll let you start counting first. And so it was pretty neat.
Oh, that's So great. So thank you, Dr. Melanie Koo and Melissa Howlett and Kim Clark. Families, you know where to reach us. You know our email addresses, so please reach out if you need any extra support before any procedures. We are here for you. We're here to support the recording as well as the PowerPoint, and any resources that we can attach to that will get sent to you after October 17th with the other webinar series. Next week is our last one. So it is going to be with educators Joanne Kachera and Rachel Elliott, who's an assistant principal. They're going to talk to you about what your child's teacher needs to know to help him or her become a successful learner. So please make sure to check in at 10 a.m. next Saturday. Thank you guys so much.
You're very welcome. Have a great Thanksgiving, everyone.
Yeah, enjoy the long weekend. Woohoo!